Caroline Johnson.
Thank you, Madam Deputy Speaker. First of all, I would like to pay tribute to the fabulous work of the council staff in my area and the local councillors, both of the Conservative Party, Independents and others, who work so hard for our local community in delivering excellent services. Earlier, my honourable friend, Member for Ludlow, made the point that the previous Labour government moved funding from shire constituencies to metropolitan areas, and as now a resident of both South Kesteven District Council and of Westminster area, I thought it would be useful to illustrate the difference between those two figures. So in South Kesteven District Council, the average weekly gross wage is £530.20. The council tax for a Band D property is £1,589.38. In Westminster, where I am during the week, the average weekly wage is £786.10, and the Band D council tax is £710.50. This means that the average Westminster person is earning more than £300 a week more, but pays £879 less for their local services in council tax. But despite these challenges to funding, despite the fact that if Lincolnshire County Council was funded the same as the average council per capita in the country, Lincolnshire would be receiving £116 million more on a budget of £500 million currently, roughly. They've been able to do some very innovative things with their funding. So South Kesteven last year, thinking about the environment, something we've discussed a lot this week, has done the Big Clean, an initiative which will visit each area of the district, each village in turn, and will improve things like fly tipping, cleaning signs, removing undergrowth and other things as suggested by the local residents, really to help improve the environment in which people live and ensure that people can take pride in their surroundings. And then Gravity Fields Festival. This has been running since 2012. It's an innovation of our local council. It's beyond delivering just the basic services. This is really the best in the country. It's a festival of art and science inspired by Sir Isaac Newton, who is from Grantham and went to the local school there. And it not just provides the children and people of Grantham with information and art and science, and some really very interesting experiences, but it also raises £1 million in revenue for the local area through visitors coming and spending their money both on staying, food and drink and the like. So a Conservative council doing its best to deliver really innovative stuff despite having a stretched budget. NKDC is similar. North Kesteven covers the other part of my constituency. They've looked really carefully at the challenge of remaining very good to the environment, but also providing the social housing that is required. And so they've won awards for curved homes and built passive houses in a way that is designed to ensure that when delivering the next generation of social housing, they're doing so in a way that is environmentally sustainable for the future, something which I say they have won awards for. Not just providing basic services, but looking at what they can do above and beyond to provide excellent services. And Lincolnshire County Council, as I said, they receive lower than the average capita funding, but they have still providing our children and young people with what Ofsted describe as strong and effective services for those with special educational needs and disabilities. Mr Deputy Speaker, the ageing population presents one of our nation's most profound challenges. It raises critical questions as to how as a society we enable all adults to live well in later life, and how we deliver sustainable public services that are going to support them to do that. There'll be 2 million more people aged over 75 in the next 10 years, and many of those will be managing long-term conditions. It's vital to make sure that local councils are supported to provide elderly citizens so that they can age with dignity. That's why I'm glad that this Conservative government has invested in social care. A 23% increase in the Improve Better Care Fund to £1.8 billion, an additional £410 million through the Social Care Support Grant, and £10 billion for adult social care being provided to councils by 2020. Mr Deputy Speaker, I really welcome the additional resources that have been provided for social care by this government. But as a member representing a rural constituency, Sleaford and North Hykeham, it's important for me to emphasise that an extra £1 for social care in London will go further than an extra £1 in Lincolnshire. Rural areas face higher costs for the delivery of public services than in urban areas. And the Honourable Right Honourable Member opposite is saying from a sedentary tradition that's not true. But of course, if one is visiting an elderly relative in their home and then travelling on to the next home to visit the next elderly relative, of course there is a gap. I will give way.
I'm not saying it's not true. The Department for Housing, Communities and Local Government's own report says that's not true.
I hear what you say, but it seems to me, yes, in rural shires we often have Conservative-led local authorities that provide their services more efficiently. But in practice, if you're going to ask somebody as a carer to go out to visit, for example, 3 elderly people in a morning, then they will, if those houses are very, very close together, such as they might be in Westminster, then you'll be able to visit those houses and spend longer with them and have less travel costs than you would do if you have to visit 3 houses in my constituency, which covers 433 square miles and is all covered by the same local county council. So, as I said, when it comes to social care, it's in large parts due to demographics and distances involved. My constituency spans 433 square miles, as I said, and has low population density, and then you have longer travel distances for staff to deliver care. Furthermore, Sleaford and North Hykeham, as a rural area, has a higher number of older residents. Older residents, Mr Deputy Speaker, that have worked hard their entire lives and now need support from our public services to ensure that they can maintain a higher quality of life. But it's not all about funding, and actually I think it's sad that so much of the debate has focused almost entirely on who's going to provide the most money, only a little bit on how to pay for it, and not so much on innovation and quality of care. The important thing is not shouting about who can spend the most money, but who can deliver the best outcomes and provide the best care for people, because that's surely what everybody on both sides of the House wants to see. Last year in Lincolnshire, there was the launch of the National Centre for Rural Health and Care. This is a grouping of the NHS, University of Lincoln, Health Education England, Public Health England and the East Midlands Academic Service Network. It's a pioneering group that will look at how to improve how we deliver care in local areas. There is also the Social Care and Digital Innovation Programme. This is run by NHS Digital. And this gives money for local projects. So if somebody has a local project where they think they could improve the care for their residents if they had a little bit of start-up funding to test it, then these projects receive money to support design and trial of digital solutions to improve care and provide value for money. So previous projects, for example, have been an exoskeleton device in the Isle of Wight to give people greater independence. Hampshire, the provision of Amazon Alexa to help people maintain independent living. There were other projects too. In Cornwall, Peninsula Community Health Service are looking at how to prevent pressure sores. So we know that in this country, 500,000 people will develop a pressure sore every year. These are excruciatingly painful. They can become infected, and in their worst case, a pressure sore can lead to such a serious infection that the patient dies. These continuous pressure monitoring technology devices will be able to help people identify hotspots even before the skin damage occurs and prevent that from happening. This is an investment in something which overall will not just improve patient care, but also save money. The Leeds Care Record looks at how people share information. So because of data protection, hospitals will have information about people, the GPs will, and it's quite difficult to share it in some cases. This looks at how information can be shared. And in fact, how referrals are made. I know when I first qualified as a doctor, all the letters were dictated and signed. Now they're typed and sent out electronically. And as an example from Cumbria, they save £400,000 a year by sending referrals out electronically. It also saves time, and where you save time, you not just save money, you improve care and you improve the efficiency of the service that you're delivering to patients. So, overall, Mr Deputy Speaker, I'm glad the Government has recognised the need to change this outdated funding formula, which has failed to accurately recognise the discrepancy in need between urban and rural areas, where rural areas it can often be quite hidden. I hope that as ministers review the findings from their consultation, they will ensure that the new funding formula adequately takes that into account. And finally, as a member of the Conservative Party, who have long been the best custodians of the public finances, it's imperative that money is both spent wisely and efficiently. The issue of social care, as I said, goes much wider than just funding. And despite the challenges facing local councils, I've seen firsthand how the brilliant work by North and South Kesteven District Councils and Lincolnshire County Council can support the people in my constituency and make the resources that we do have go as far as possible.
Thank you very much indeed, Mr Deputy Speaker. And I wanted to address most of my remarks to the issue of